Advances in heart failure services have been up and coming for many years now, and I would have to just frame the discussion first by saying that heart failure remains a big problem in the world and in America. About 5 million people have heart failure diagnosis in this country, and every year there's about 500,000 new cases of heart failure given. There's about a 50% 5-year mortality rate in those patients with a heart failure diagnosis. So it's a big deal, it's a big problem that we have to address. The advances with heart failure are the routine use of medications that we give patients, which are basically dual-purpose medications, pills that have been developed for blood pressure management, which also have been shown to help with heart failure improvements. So patients who take ACE inhibitor class pills, ARB, or angiotensin receptor blocker pills, beta blockers, so-called pills like lisinopril, trandolapril, losartan, valsartan are the usual types of workhorse medications, metoprolol, carvedilol. These have been shown to keep people with a better quality of life, keep them out of the hospital, and generally speaking, hopefully improving their heart efficiency. And this is in addition to the standard fare pills of diuretics, water pills, Lasix, furosemides, Demodex. So the first advance in heart failure would be those routine use of medications and guideline-directed medical care, which in contemporary medicine gives us a lot of leeway to use pills appropriately in the properly selected patients. Now, as technology has advanced, we also now reach for device-based therapies, so the implantable cardioverter defibrillators to help save people from lethal arrhythmias when they have heart failure, and those patients with advanced heart failure who then require synchronization therapy with so-called biventricular device therapy, and pacing the heart a little bit better so we're able to properly restore its mechanics helps. Additionally, people who wait for transplants now, heart transplants, and need a donor heart while they wait, there's a role for these mechanical assisted devices. So left ventricular assist devices are becoming much more prime time, either as a bridge or a destination device therapy. That speaks more towards just the general lifespan now, especially with people with cardiovascular disease. Many people were dying in their 60s one generation ago. Now people living well into their 90s and beyond. I take care of patients from all age ranges, 17 up to last week I had a patient who's in her who's 100. Yeah, so, and she looks great and she's being managed as best we can. Now that's how pills have helped people keep out of trouble and in relative good quality of life, in addition to whatever they bring to the table in terms of their proper lifestyle modifications and their genetic backgrounds. But where we can, we like to try to help people. The biggest misconceptions about heart failure is that the heart is failing, and that's not entirely true. Number one, it's a bit of a misnomer. So we see when patients are given a diagnosis of quote-unquote heart failure, about 50% of the time, true, the heart has failed on some level or another, mild, moderate, or severely reduced heart function. About another 50% of patients have the so-called preserved contractility heart failure variant. So their heart is still pumping well, but they have a stiffness or less compliance characteristic to the heart. Ultimately, it's the same end result of fluid accumulation in the wrong places in the body, shortness of breath, weight gain, edema or swelling, and general fatigue and exercise intolerance. But it's just a different way to address the name of heart failure. I'm a little discouraged that people kind of use heart failure as a fast and loose diagnosis. Anybody with shortness of breath does not necessarily have heart failure. Yes, shortness of breath is one of the main symptoms of heart failure, but it's not the absolute definition. And so when patients are truly having heart failure, it's a much more treatable condition than it was a generation ago.